there. Well, thank you guys so much for having me back. I'm so excited to be here and talk about this subject again. Just by show of hands, how many of you were at the part 1 of this? Okay, all of you. So the reason that I asked that is because much of the material that I have here is kind of similar to the same stuff that we talked about the last time. I was speaking about dementia, and for that one, I was really talking about the chaplain's role with someone with dementia. And so for this time, I thought maybe I could talk a little bit about everyone's role with someone with dementia, just kind of as the person who knows someone who has dementia. Maybe you're the caregiver, maybe your friend is caregiving for someone with dementia, maybe there's a fellow congregant that's caregiving for someone with dementia, and just kind of what we can do to help them. Just as kind of a refresh, I'm going to do just this quick definition of dementia. Dementia is simply the loss of cognitive function that affects your daily life. So this is not a normal part of aging, even though half of everyone over 85 experiences this. This is a true brain disease that happens. When we're talking about dementia, we're talking about it being an umbrella term. So I want you to just envision dementia as this big banner up here. And then underneath it, we have all the different types of dementia. And there are many. The most common one, the one that we've heard the most times, is Alzheimer's disease. That's half of all dementias are Alzheimer's disease, so over 50%. This presents with the trademark memory loss that we see in so many patients with dementia. The symptoms typically show up around age 60, and they're slow, and they kind of progress on over the months and years. Anytime the person has a change in living situation, or maybe a change in daily life structure, sometimes these symptoms all of a sudden become very evident. So it seems like it comes on very suddenly, but in all actuality, it's progressing over time, and we just have these little moments that reveal what is happening. With this type of dementia, with Alzheimer's disease, that memory loss is what we think of with it. And so we're talking about this person with memory loss, and we're talking about kind of what that looks like. And so this is the same analogy that I used last time. Again, this is just kind of a refresh, but the best analogy that I've ever heard for this is if we had a patient who has Alzheimer's disease, and we had a big chalkboard here, and we took a piece of chalk and we wrote out their life story, starting at the very top with birth, and we just wrote out everything that happened to them in their entire life, and we end at the bottom of that with present day today, what life is like. Alzheimer's disease is going to come along with an eraser, and it's going to start at the bottom with the most recent memories and just start making big, broad strokes. So for that patient, in the beginning, those changes are very subtle, right? Because it's just kind of that most recent stuff, and it just seems like forgetfulness and whatnot. But over time, as more of that chalkboard is erased, then we start to see this really prominent confusion that takes place. And we'll kind of go back to that a little bit. Another very common, again, dementia is our big banner, and then there are all these different types underneath, right? Alzheimer's disease being the most prominent type. Another type that we see sometimes is called vascular dementia, and that is consistent with a stroke event. This is kind of seen through imaging on the brain. You might see physical symptoms of a stroke that happen, like a change in gait or difficulty swallowing, and then there can be memory loss that presents, and that's kind of how we notice that there could be vascular dementia. There's a type of dementia, this one affects, from what I've read, only about 15% of all dementias, and it's called dementia with Lewy bodies. It's very difficult to manage, not that any of these types are particularly easy to manage, but for dementia with Lewy bodies, this will present with some of those same symptoms, but also including visual and auditory hallucinations. So you can imagine that would be very difficult to manage in a home setting at times. And then this other type of dementia that I always talk about anytime I'm in a group is called front temporal dementia. And there are others, but these are just kind of 4 big ones that I always like to talk about. Front temporal dementia only affects about 10% of those with dementia, but it affects my father. So I'm very, very familiar with this type. This type does not present with memory loss, so it's very tricky to diagnose. This is the type that affects the front temporal lobes of the brain, which are the lobes of the brain that affect your judgment and reasoning and impulse control. So in this type, what you see is more childlike behavior and kind of increasingly inappropriate social behavior, things of that nature. This one is very near and dear to me. Like I said, my father has front temporal dementia, and he and my mother now live with my husband and I, and we help caregive with them. So that has been a very interesting learning experience for sure. Some of the things when we think about patients who have a type of dementia, some of the things that we see that are affected, obviously the memory and confusion. When we think about that chalkboard and we come and we talk to someone who is experiencing this type of memory loss, they seem very confused and very, like oftentimes they know exactly where they are. It's just not here. It's just not this right place. Sometimes it's very difficult. You'll see, oftentimes we talked about the last time I was here, if you've ever visited a memory care unit or if you've ever visited a nursing home, you'll see people carrying a baby doll. And on their chalkboard, they've erased way back to here, to the 20s and 30s, when they were raising babies. And they have their baby, and that's their job every day. And so oftentimes you'll also hear them talk about, for men, I often hear them talk about going to work, putting their boots on, going to work. They've been retired for 20 years. But today, they've got to get to work. And it's, that's where they're at on that chalkboard. They're in those working years where that's what they're doing. Sometimes you'll notice that their language is impaired. Sometimes they have difficulty finding words. Oftentimes they have difficulty articulating the words. And sometimes they can find words and articulate words, but they don't make any sense at all. They're out of order, or they just seem to be that technical term we call word salad. Judgment is a big one. Like we were talking about front temporal dementia, that judgment impairment, it seems very subtle, but really this is a huge factor in daily living. Just to kind of give an example of what that looks like. For my father, there was an evening where my father takes out the trash in our house. It is his job. He gets angry if anybody does it for him. He actually monitors the trash level. He knows when it's getting full, and he recognizes when he comes in and it's now empty and somebody else did it for him, and he gets very upset about this. So we have a lot of trash cans in our house that we probably don't even need, but they make him really happy. It makes him really happy to take out the trash, so that's what we do. So when he was taking out the trash in our home, my husband and I are not the best about taking out the trash when it needs to be. We push the trash down a few times, if you've ever done this before. So this one particular time we had pushed down the trash several times, and when my father came to take it out, he removed the lid and a napkin fell off to the side of it. And our kitchen is just, it has all this tile. I mean, there's just space everywhere around this trash can. And he has the trash can in front of him, and he has the lid sitting next to him, and the napkin has fallen off on the other side. And so I'm kind of doing dishes and kind of mentally, I'm always watching. I'm just always watching what he's doing, because you never know. And I watch him, he sees the napkin, he knows he needs to pick it up, and instead of walking around to grab it, he just takes one big step and he tries to go over the lid of the trash bin. I'm like, what are you doing? And I run and I kind of hook his belt loop real quick and hold him up, and he said, I have to get the napkin. I mean, he did not see another way. He could not envision that. And so that sounds like a very, for my father, I'm always watching him. I mean, I'm big brother in that man's life. My mom is there. She co-caregives with me. My husband is there. My daughters are there. So there's eyes on him all the time. But imagine if he lived alone. It would be very, very different. And this wouldn't be something that just being around him for a few minutes you would pick up on, right? It would take that kind of everyday watchful eye to see. So that is one of those, just one of the small examples in our life, anyway, that we see with that. We talked a little about orientation, not being oriented to place or to time, and this practically results in oftentimes people getting lost just having gone outside the house. They all of a sudden don't realize where they are. Or we've talked to people in nursing homes who have said they have a difficult time getting their patient or their loved one with dementia back into their room because that patient knows beyond the shadow of a doubt that they don't live there. They live on a farm in Illinois. They do not live in that building. And so you can imagine how difficult that can be. There are so many different things here. Ability to sequence task is something that sounds like a big fancy schmancy way of just knowing how to do things in order. These are all things that you and I probably take for granted. You don't realize that you really can't brush your teeth if you don't know what order you're supposed to do things. Imagine trying to do that having not removed the lid to your toothpaste. It's not possible. And so these are things that are just major frustrations for someone who has a type of memory loss or cognitive impairment. In looking at some of these things and talking about some of the caregivers who we really tend to focus a lot of our time and effort into in this community because it is such a big job. I know in our life, this looked like, a couple trips to Illinois where my parents lived for a very long time, and just noticing this increasingly enlarging frustration. Every time we were there, it seemed like my mom was more frustrated with him than the last time we were there, and it seemed like he was a little bit more frustrated than the last time we were there, and his behavior was changing a little bit in very subtle ways until there was kind of a health crisis. And at the point of that health crisis, it was summertime. We were living our best life, just going to the pool and having fun, and then we got this phone call that just kind of changed everything. It happened that fast. We got a phone call that he was having kidney failure. We didn't know why. And so we went to Illinois to be there throughout all this, and we ended up finding out we had to have some dialysis for a few weeks, and his kidneys enjoyed their vacation, and they came back to work, and we thought this was the end of it, everything's good. And then he came home, and it very quickly became evident that he was not the same person. And so from that point, that's kind of how we got to that place of maybe it's time for them to be in our household. Maybe we need to be helping with that. At the time that we did that, we just kind of did it. It had to be done, right? There wasn't really a lot to talk about or do. It was like, gosh, we have to do this. What came after that was just a whole slew of things. We have 2 children that were so excited for Nanny and Poppy to move in until they realized that Nanny and Poppy were not the same people that used to come and visit them and drive them to the restaurants and do all of these things, right? Nanny and Poppy actually need us to do those things for them now. And so that was disappointing and difficult for our kids to deal with in some ways. In other ways, we noticed our kids kind of got a little bit jealous of the time that it took us to caregive for them, which is completely understandable. We had to get doctors set up, and we had to get evaluations set up, and they had medical issues popping up all over. Just in the year that they've been here, I think my dad's been hospitalized 3 times. My mom had her gallbladder removed. We've had just all kinds of, these are typical life things, but to our kids, it all takes away from time with them. So that's been an interesting factor there. And all of this, I share all of this with you because this is all really just what happens in the life of every caregiver dealing with something like this. For us, like I said, we're very blessed. I have my husband who's very on board with helping take care of my parents. I have my mom who is able to co-caregive him with me. But that's not everybody's story. And I meet people every day who are an older couple and just no kids nearby or no family nearby, and they're just trying their best to survive this. And so that's kind of the thing that I wanted to talk about the most today are these caregivers. How many of you in the room have been touched by dementia in some way? Maybe it's a loved one or through your work. Gosh, yes, so almost everyone. So having caregived before or having been around someone who's caregiving, you know the stress that causes. Oftentimes these caregivers are completely overworked, just exhausted, sometimes working full-time, trying to balance their own family life, and then coming and caregiving for this person. Sometimes they are, sometimes they are in that position where they're having to make big decisions and they don't have any time to think it through. Something has to be done now. It's just one phone call that changed everything. Oftentimes we see they're aging rapidly because of just the stress of this. And so we talk sometimes about what we can do to lighten that load and ease that burden. And some of the things that we thought of, some of the things we were talking about for very simple things like simply being present for that caregiver, simply being willing. It is very uncomfortable. If you've never been around someone with memory loss, it's very uncomfortable to be around someone with memory loss. It's very uncomfortable. You don't know what to say sometimes, and you don't know if you're supposed to kind of go to their place with them or try to bring them back to reality. You don't know what to do. And so sometimes it goes often, long periods of time, that caregivers don't have anybody really willing to just be present in that with them. It's very isolating. So thinking about some of the things that we can do, I would say the first thing would be just being willing to be present with people who are going through this. Another thing is connecting them to resources. There are so many resources out there that are there to help them. Most of them are free of charge. Many of them are free of charge. Or if not, there are things that you can look into to help with the cost of some of that stuff. I asked a special guest to come with me today, which is Tracy Kendall Wilson. She's sitting here next to me. She's the regional director of an organization called Alzheimer's Tennessee, that is a nonprofit organization that provides a plethora of services to those living with any form of dementia, from caregiver resource fairs where they can come out and see all of the different things that are available to them, to one-on-one, just in the home, sit down to talk about how we deal with some of these behaviors and some of these reactions and responses that are happening during daily caregiving, to just so many different things. I asked her to come with me today because I was overwhelmed. The last time I was here, so many of you came up to me afterwards and said, man, my father had Alzheimer's disease, or I used to work in a memory care unit. I remember how this was, or so many different things that this has touched so many of us. I wanted to make sure that we had a good resource here that we could go to with questions or just to help with any sort of practical things that we can. Other than that, I don't want to necessarily reiterate everything that we talked about last time. I would just love to hear if you all have any questions about this, or if maybe you have been someone who has been a caregiver for someone with dementia, or have any questions about how to help practically meet the needs of those who are facing that. How are we doing that? Just allowing people to ask questions as they wish? Or, okay. Okay, sure. Yeah, so if anybody has any questions currently, would be willing to answer those for you, or I'm always available afterwards if you would like to ask questions in that way. Sure.
Question for this, but you were mentioning the 4 different types of dementia.
Yeah.
Third one?
Yes.
The third one was dementia with something. What was that word after dementia?
That word was Lewy bodies.
Dementia
with Lewy bodies. Yes. Interesting title. Perfect. Tracy was just mentioning to me she has lots of information about those different types of dementia, specifically about Lewy body dementia and some different things there. Yes.
Tammy, my nephew is taking care, he's an only child, taking care. His mother lives across the street from him alone, and she has dementia, and he has his dad with him who has vascular dementia.
Oh my goodness.
And he's an only child, but because of their resources that they have, which are basically tied up, so it's mostly property. What kind of resources are available to someone in that situation?
So in that situation, the best thing that I would recommend doing would definitely be connecting with someone who is well-versed in all of those resources and in what it takes to qualify for those. Because like you mentioned, you said most of their resources are tied up in property. I know that can be a big issue for some people, but there are some things available out there. I don't know enough about them to speak about them specifically. I would definitely say that would be a good question for Tracy, if there's anything that that we could chat with about that maybe afterwards, because that is a very difficult situation, and that's not uncommon. We see that oftentimes, that people, they're afraid of some of the programs that can come in and help because they are afraid that it's going to take their home from them at the end of life or something of that nature, which is a very, the last time that we did this, that we had this conversation here with you all, Chaplain Holland was here, and she had mentioned that oftentimes when people are talking about giving care or providing treatment in the hospital or et cetera, people feel so bad to ask this question, but truly it matters. How are we going to pay for this? It's like you don't want to say those words out loud. You don't want to seem cold. You don't want to seem like this is about the money, but how are we going to do this? That's a very valid question and something that's very difficult. So there are some options out there. Of course, it depends on the specific situation. And so I would say that would be a good thing that we could talk about afterwards.
After you were here last time, I did check into some things, did a lot of internet searches and all places, and I didn't get anywhere.
Yeah. It can be very difficult to go into that world and try to navigate resources, not knowing exactly what the criteria is for them and et cetera. Completely understand. Well, if you all have any other questions after this, I would love to talk with you after, and just to be available for that. I know it can be hard to think of that stuff on the spot. I hope that sharing my story with you was somewhat meaningful for you. It can be a very difficult road to travel, and the biggest thing that I've realized throughout this is the more that I talk to people about what's going on in my home, the more that people open up and share with me, gosh, we went through the same thing 5 years ago or something like that. And so what I'm realizing is I feel very unique. I'm in my 30s, my mid 30s, as I like to say. I try to push that to as young as I possibly can. And so I feel very alone doing this at my age. Most of my friends are like going to Myrtle Beach with their mom for a girls' weekend or doing things like this. I just have older parents. But really and truly, the more people that I talk to about this, the more that I'm realizing this is something that every one of us think of one day. This is that everyone with a mom or a dad will face. What are we going to do at some point? So I'm glad to be around, and I'll be sitting here with Tracy, who I just assure you is the absolute guru on dementia and Alzheimer's resources here. So I would love to talk with you after. Thank you.